I started retirement in 2003 when I turned 65. I knew I was going to have a good time as long as I was healthy and active. My name is Joanne Chin. I'm 70 years old.
I looked upon retirement as something that I thought I would enjoy, and I do love to travel. I'm Hal Showalter. I'm 77 years of age.
I retired in August of '94. I wasn't ready to leave my job. I really liked it. I'm Lexine Dent. I'm 74 years young.
I failed retirement 3 times, and each time I went back, I would say, you know, this is very part-time. I'm Edie Ekstrand, and I am 69 years old.
Medicare is not enough.
Medicare is like Swiss cheese. It's great to eat. The problem is there are holes, and there's a lot of holes in Medicare.
I was a little confused because I knew there was Medicare Part A, Medicare Part B, and now Medicare Part D.
You have a lot of co-pay. You also have areas where I was in the hospital under Medicare where I had to pay almost the entire bill.
I had choices. I did not pick out the Cadillac plan. I took middle of the road.
I have very few out-of-pocket expenses other than the co-pay for my primary care, $20 for specialists, and fortunately I've never needed to go to an emergency room, but that would only be $50. So all of my costs are basically covered. I'm very fortunate.
I needed to look at a program where, number one, my physician was on the panel.
I chose Medicare Advantage mostly because of the prescription coverage.
I take 3 different medications, and I have a copay of $20 for a 90-day supply of medication, and that's excellent.
The areas of things that I looked at were, did they offer case management?
Well, I like the fact that they have programs to keep you fit as you get older and to be more active.
When I came out of the hospital, I knew I had to change my diet. I had to change my way of living. And then when I found out about the Medicare Advantage program in January of 2006, I joined, and then I got involved in the Silver Snickers, which is a fitness program, and it's been the best thing that I ever could have done.
When I got home, I said, okay, pulled out my medical cards and looked at the number on the back. And I knew that there was a nurse on call. I certainly knew that there were case managers.
I'll check with you next week. And
Kim has been my advocate.
We get to learn and listen and teach and educate and just, you know, live through the process with the patient. All right, take care for now. Bye-bye.
Am I concerned of what the federal government is talking about right now? I am very concerned.
It is so important that we pay attention to what Congress is doing.
My congressman has told me that yes, it costs taxpayers money now, but they don't have to pay later because these people are in better shape. They're going to the doctor on a regular basis, and so they aren't going into the hospital for serious injuries or illnesses that they would if they didn't have the Medicare Advantage programs.
definitely, if Congress cuts any Medicare Advantage programs, it's going to mean more costs to every person that is paying for their Medicare Advantage program.
If I were to talk to my congressman, I would ask him, please do not touch Medicare Advantage. It's extremely important for the seniors.
It would actually make a difference in our daily lives.
If I have to pay more insurance premiums, then that's going to be eaten up. I'm not going to have any discretionary funds. You know, I'll have to do without. Well, I'll have to do without. I'll have to do without.
I went to Washington, D.C. to meet with my congressman.
You need to let them know.
You need to speak out.
Keep Medicare Advantage alive.
Support it.
Medicare Advantage.
An important choice
That needs your voice
Now.